This episode, I'm chatting to May and Bambang. May is a clinical nurse consultant based in Melbourne at the Royal Children's Hospital. May's been at RCH since 1985. She manages and coordinates the care of pediatric cardiac surgery patients, ensuring they and their families receive the highest standard of care and support. May is also joined by her colleague, Bambang, Associate Unit Manager at RCH, who works closely with May in their cardiac theatre team.
My vision about this very intensive type of nursing, quick space, very challenging, and treating the care holistic as much as possible, treating not just the patient, right? Not just a number, but as a patient underneath the drapes, and also thinking about if this is your child, how would you best treat this child?
To begin, we'd like to acknowledge that this podcast is being recorded on Gadigal land in Warrung, otherwise known as Sydney. We acknowledge the traditional owners of this land and the land that you're listening in from today. We pay our respects to the elders, past, present and emerging, and pass that respect to any Aboriginal and Torres Strait Islander listeners. Well, thank you for joining us. Very exciting to have you here. May, as I mentioned, you've been a nurse with RCH since 1985. Tell me a little bit, I guess, about your background and how you kind of came into pediatric cardiology.
Thank you very much for inviting me and Bambang for your podcast, and we feel really privileged to be considered. Yes, I'd like to share a little bit of my nursing background. And to start off with my humble beginnings, it is way back in 1972. That's when I first started my general nursing. I flew from my homeland, which is Malaysia, and landed at Heathrow Airport in the middle of the night after 20 hours of flight. Those days are just long. But anyway, I persevere and I achieved my general training at a hospital called the Royal Cornwall Hospital, southeast of England. And then I proceeded to do midwifery in Scotland. And one day I saw the advertisement that Australia is asking for new recruits from UK. And my best friend and myself jumped on the next plane, and here we are in Melbourne from that very day, from 1978, I think. I actually practiced as a midwife initially at the Royal Women's Hospital, but I changed my direction to be an operating room nurse. I loved every minute of my general training in UK, thanks to my wonderful, caring, and very strict English sisters. They're called sisters because they are trained nurses. In England, they call them sisters, and you never address them by their names. And funny enough, currently, my boss, Christian Brizard, calls me Sister May. Well, I take it as an endearment. So my first ward actually allocated as a very junior nurse was in casualty, but it's emergency department or ED these days. And one day, a child was admitted to casualty with very, very blue lips and with difficulty in breathing. I knew very little about cardiac those days. I have no idea what was going on, but the child was rather whisked away rather quickly. And to cut the story short, I discovered later this patient was actually discharged home, healthy, after going through open heart surgery in London. I said, oh, wow, I want to be part of that. That has actually laid my foundation as to why I like pediatric cardiac nursing these days. And so now I'm actually standing next to the surgeons and, helping to repair those little hearts. That patient, by the way, has a normally called a pathology of Fallot's. So it's a common childhood disease and is treatable, of course, with surgery. So that laid my foundation. That's how I like pediatric cardiac surgery so much now. I want to be part of it. And here I'm part of it.
I love that.
After so many years, since 1985 when I joined the Royal Children's Hospital.
1985. Do you have you gotten sick of it yet, or do you still love it?
No, I still come to work quite excited, to do. Every day is different.
Yeah.
Yes, I'm not sick of it at all because I can see that, I treat it as my vocation. Like I like to do this sort of work and I like the hustle and bustle of cardiac surgery. There's no day is routine. No day is a routine day for me.
I love that. What about you, Bang? How did you get into cardiology?
Yes, I'm starting in Indonesia in 85, working in Jakarta. And then my centers would like to establish the pediatric cardiac surgery So all the teams come to Royal Children Hospital in Melbourne because the Royal Children is the world's famous hospital for cardiac surgery. And sure enough, in 1990, I was sent here for learning until 1991. And then some 10 years back to Indonesia, established the pediatric cardiac surgery in Indonesia. So I have opportunity actually come back to Royal Children's, working as a part of the team, which is very proud because this team is my dream team.
I love that. That's so nice. That's so good. And I guess in terms of, I know that you've just told me that every day is different, but I guess in terms of your responsibilities and your typical day to day for both of you, what does that look like?
Well, actually, I start my day. A typical day for me is 5:30 in the morning with yoga on my mat. That's how we keep us going. Yeah, yoga my mat. And our shift actually starts at 8 o'clock, but I like to be here at 7:30 so I can check my email, talk to my cardiac coordinator to see if there's any changes, talk to different craft groups, and to get the schedule going. So we literally, the patients in theater by about 8:15. So we start both theaters running by then, and there's a lot of communication throughout the day with different craft groups, change the pace of operating or change the schedule if there's emergency arriving in the Rosella, which is our ICU. So there's a lot of communication right through the day. But my focus for the day is to have a momentum on delivering clinical care. My focus is about, okay, we're changing the list, but we have to prioritize and be flexible in thinking how we're going to manage that within the hours of operating. The typical day, I would say there's no typical day for us, but a day is atypical. But having yoga on the mat is typical.
See it. I love that. What is it? Win the morning, win the day. Every day.
Yeah. Every day. Good stretch at night as well before going to bed.
Yeah, I was gonna say, how do you like unwind? Start the morning with yoga and the day with yoga, kind of.
Yeah. Help. For Bang Bang, I think you pray. Bang Bang does pray in the morning, no doubt about it, and that is that's how he remains so calm and cool right through the day compared to me.
He keeps you grounded.
Yeah, he keeps me grounded. All right. Yeah.
I know that you mentioned in terms of clinical care, and I know you've been involved in the standards of care for childhood onset heart disease. I know we've spoken about that before on the podcast, and I think it's a really abstract thing when they're starting to be developed. But I guess in your perspectives, what does that actually look like practically? Having that standard of care, what does that mean for families and patients coming into a hospital?
Yeah, it's a very good question. My vision about this very intensive type of nursing, quick space, think on your feet, they're very challenging, and treating the care holistic as much as possible, treating not just the patient, right? Not just a number, but as a patient underneath the drapes, and also thinking about if this is your child, how would you best treat this child? How would you care for this child? And also, how would the family think, how much we've contributed to the care? We always have that in mind. I think having that in mind, you would actually do a fairly good job, I would say. Yeah.
One of the things that I think a lot about when I talk to my mum and dad about that process of them understanding what was going on before surgeries was they really valued people that took them aside away from the hustle bustle and kind of step by step answered their questions and asked that sort of stuff with them. And I guess for you guys working in this hospital and having this every day, how do you spend that time with caregivers and parents to make sure that they do know what's happening and I guess they understand what's happening?
They have a very good process initiated initially by our cardiac coordinator, and she's Kate in the administration office. So they have a pre-admission clinic. Once a patient is waitlisted on the list, they have a patient's portal, and then have a pre-admission clinic. So from the portal and the pre-admission clinic, X-ray test is done to make sure the surgery goes ahead. And they get a lot of information about the pre-op stay in ICU, how they actually comes to theater, their journey, in other words, throughout the journey in operating suite. And if the patient is really complex, they are assigned a care coordinator in the post-operative phase. When they actually arrive in theater, we accompany them into theater, and one of the parents will come into theater before the patient is induced to sleep. And then we accompany the parents out. So at that point in time, you'll be amazed that, surprisingly, I say, they talk very little because they're so well primed already, pre-op and post-op. We're very sensitive about the emotions, the anxiety. So it's a case-by-case scenario. The nurses are quite well trained to assess that, the physical and the mental well-being of the parent when you accompany out of the room. So, and we usually, ask if they need anything else. Do you need to distress yourself? We suggest that you can go down to the family hub, which is on the ground floor north building, where they can have coffee or walk in the park or do things that, will occupy the time. However, I've come across parents, most of the time, they would tell me that I need to go and do laundry. I say it's a good thing to keep your mind away while your child is having surgery.
We all cope in different ways, even if it is laundry. I know there's a lot of tension sometimes when we talk about this stuff about, I guess, giving people in stressful situations too much information or giving them all the facts. And I guess from your experiences, do you think it's better for them to be empowered with that knowledge? Do you think that helps them emotionally in those kind of situations?
Yeah. As I said, as you just said, they're empowered with the knowledge already. All right. And there's little needs to be said while the child is actually in theater, because this is the crux of the moment. All right. Eventually, they're primed to have this surgery. The surgeons have talked to them in great length. So, having that lighted, quiet spot as they leave the theater, I'm sure they're full of thoughts, anxiety, and, just give them a breather. In other words, we answer the question if they ask us. But we'd rather give them a breather, let them just quietly go to the sport and go and do their laundry.
I love that. Looking back on your careers, has there been, I suppose, a particular bub along the way or a particular family that has kind of stayed with you and that you remember their journey?
Yes, I have remembered a journey. I can relate to an incident that eventually it was a pleasant outcome, but it wasn't pleasant at the beginning. And, and it was very challenging for myself and the parent herself. It was actually during the COVID pandemic era. There was an emergency admitted to, Rosella, which is our ICU, and the child was admitted with sepsis. So we all treat the kid as if the child has COVID, so suspected COVID, and is nursed in an isolation room. So here we are, this child can arrest anytime. So we need to attend to some emergency procedures for the child. So I fronted up, I was on call, fronted up, put all my PPE gear in, the goggles, the full hood, the gowns, everything. Went into in the room and I saw the mom. So at that instance, she didn't understand why she had to leave the room. The ICU nurse was trying to get her to leave the room so that the surgical team can attend to the child. But she didn't want to leave the room. She was really anxious, was crying, but nonetheless, by the way, she was Vietnamese, so she couldn't understand much English. And all I did was tap on the shoulder and practice some transcultural nursing at that point, or spiritual, if you like to call it, and put my hands together in a prayer position and chanted some sort of Buddhist chant. It wasn't Buddhist chant, it was my yoga chant, namaste. So, and she just looked at me and she put her hands together again, and we both sort of, not then do some like Buddhist type of action. And then she was happy to leave. She was grateful. The child, eventually had the emergency procedures done, and it was a good outcome. When I saw the mom again, when the child is in ICU, we attend to a few more procedures on and off. So every time I entered the room in PPE, she said, chanting away. So there was one of my experiences that I will not forget.
Stuff stays with you.
There are many others, but this one really caught my,
Yeah.
I will remember it for a while, because the mom was really grateful. As you said, she didn't speak much English.
Yeah. And just having someone there when you're stressed out to be like, you're okay. Like one of those weird moments where language doesn't really need to be there. It's just an understanding.
It's the action and the body language. It tells a lot to the parents, how you behave in front of them.
Yeah.
And, how you appear in front of them.
Yeah. Beautiful. I guess in terms of looking at both of your journeys from when you first started in medicine to now, and I know this is going to be a huge question, but I guess what have you seen evolve in pediatric cardiology care? And I guess in terms of what you do, what has been one of the best things that has changed in the space?
Well, yes, I can relate that to the past. When I first started here, there was only one cardiac theater with 4 nurses and 2 surgeons. The evolution now advanced to a state where the cardiac surgery is one of the most renowned in the world, a big center for training fellows and managing interstate patients from South Australia, Northern Territory, and a bit from Perth. The complexities from Perth just come to us. And it's huge. It's grown a lot, over the years. And I would say it has evolved successfully under great leaders and for the past and the present. That goes without saying about my predecessor unit manager, Debbie, who actually trained us well. She was authoritarian in her thinking, very military, but she really trained us well that we can actually, be able to function with only minimal staff. And great thanks to her, and she managed very well before she retired, of course. And then I took over in '85 since, and it was a great era. Over the years, there's ups and there's downs, no doubt about it. It's not just all ups, but there's a lot of downs as well. But cardiac surgery, nonetheless, have progressed to a state that now we have 2 theaters, and ICU has expanded. The post-operative ward, which is called the koala, has expanded. So, and a lot of services, the peripheral services have all expanded. It's just not us. But without the peripheral services, I think cardiac surgery wouldn't get where it is today as well. So there are programs, scientific programs, such as the ECMO, the extracorporeal oxygenation program, and the bridge to transplant program, we call it the ventricular device assisted device program, such as the Berlin Heart and the HeartMate 3 now, which it really is a bridge to transplant. These are the advances technically in our service. And in 1985, there wasn't even heart transplant being offered, but it happened in 1988. And remember the date, 4th of October, we were here doing our first transplant at night. It was great. It was such a feeling that the transplant went very well. And this is evolution of time. It's a lot of progress has been made over the years, and so on in the human resources side with the number of nurses have grown. So yeah, we still have very loyal nurses who have stayed with me since, like Bang Bang.
Dude, I feel like you guys are gonna be. It'll be 20 years time and we'll be having this conversation again, you guys.
Oh, no. I can tell you in 20 years time, you'll be talking to a different person.
Oh, don't tell me that. Look, I guess as well, I think I know this in a personal aspect, but when there's new research that comes forward, I think for a lot of heart kids, we kind of interact with that research via a specialist. Yeah. I guess when we talk about it in a clinical sense and in surgery and in hospital sense, how does, I suppose, new research change the way that you do processes?
Well, at this point in time, I have to congratulate our chief perfusionist, Steve Horton. Right, he's one of the one who's masterminded a lot of research behind the cardiopulmonary bypass techniques over the years, and we as nurses work together with him along that. So he's the perfusion department, where perfusion meaning they run the heart-lung machine, and Steve Horton really masterminded a lot of techniques behind the cardiopulmonary bypass techniques. And without it, without his research, without his innovations, cardiac surgery would not be having such good outcome. He's one of the highest level of scientists I've ever worked with. So, research does contribute a lot to outcomes and actually encourage the nurses to look at practices that's historical be instilled into us. But why are we practicing historical practices when there's no evidence base? So, with research, it will move us forward. It will move the nurses to thinking about doing the masters or something that they are interested in, so that it can actually improve outcomes. It definitely helps outcomes. And if you talk about scientific research, we do a lot of it. We more or less assist the surgeons to collect, specimens or whatever they need in the form of research. And we strongly have very strong link with MCRI as to why they're doing the research. It's a good thing that is for the good for the nurses. But Steve Morton needs to be recognized, his innovations, with towards the VAD program, the ECMO program, and one of his baby is isolated cerebral perfusion. I won't expand on that, but it really has helped a particular congenital group of patients, the hypoplastic left heart syndrome, really achieve great heights. Yeah.
I love that. Yeah, changing lives
Yes.
with it. I do want to step back just a little bit, because we had a conversation a little bit earlier about, I guess, the process of supporting parents. I guess from your perspective, what is the advice for a parent that presents to a hospital who is a little bit anxious and isn't quite sure what's going on? What would be, I suppose, your advice to them?
I can offer my humble suggestion pertaining to my yoga philosophy, if you don't mind. And I do think that, to advise parents that's super anxious, no doubt about it, that different levels of anxiety. Some parents cope well, some don't cope so well. So I would actually offer my humble suggestions as to think about the mind, body, and soul. The mind, being mindful and be honest with yourself. You got to be mindful of what you can do now and what you can do in the long term, right? As for the body, your child has surgery. So there is life changes in your lifestyle. There's a sea change. So everything is going to be a little bit different. So in other words, you got to look after yourself first. You have to have good nutrition, good rest, good exercise, some sort of a activity that you can cope looking after your child, because there is going to be a change, no matter what it is. And thirdly, I would say soul, and you're never alone. There are a lot of kind souls out there, especially our cardiac coordinator, Kate. She's full of information, full of patients' information, and and she's given direct numbers for all these parents to ring her at any time. So there are a lot of kind souls out there, and you're never alone. So feel free to ask for help. Don't take it all on board yourself that there's no one out there, and you're left standing alone, not understanding what cardiac surgery is all about. There's a lot of kind souls out there. And lastly, I would say, if you're an interstate patient or going to interstate with a child having cardiac surgery or come for cardiac surgery at a children's from interstate, you're never alone too, because with the national standards of the heart kits, it's going to be published soon. No matter which state, we're going to be practicing the same way. So don't, be anxious, or, the anxiety level that, oh, you're going to New South Wales, it's going to be different. That's why we're doing the national standards for heart kits. You're going to be the same. So just be reassured. Yeah.
Perfect. And look, my very last question is, obviously you've dedicated so much of your life to being kind souls in the cardiac pediatric area. Thank you. But my question is, why do you keep rocking up every day? What is it that is so rewarding about what you do?
Yes, I can break it down into a few points. One is to actually, the very important thing is to have a feedback about the family, how they do. When we receive thank you cards from them, a little notes, and the feedback from the surgeons, like we have meetings every week to say how the group of patients we operated last week, how are they this week, and the progress. So we like to have some sort of feedback. And as I say, things are not always panning out 100% well. And there are times that not so well, but at least the nurses, the team is aware that they're actually doing what they can to improve their health outcome. So that's a good thing. And to have received thank you notes from the parents is a wonderful thing. Occasionally we do. That's the best ever. And indirectly, we know that we have contributed to the care. And why we front up, the other thing is about this hospital is so renowned for this training. I front up as well because we are part of it. The nurses are formed a part of a major training program for the fellows from overseas. And to know when the fellows leave after 1 year that they can become consultants in their own right, in their own country, and also run units like Kristen Brazard does, is a wonderful thing. That's why we front up to be part of that. And lastly, having nurses coming to be trained in cardiac surgery and take cardiac surgery as a vocation, and how they progress from very inexperienced nurses to a level where they can perform, individually and autonomously. And, that's what makes you happy, that you want to come to work and help these young nurses to progress and stay in cardiac surgery. Don't go away. This is rewarding, for, especially families, and the nurses become, the soul of the unit, more or less. Yeah.
That's it. Look, I remember a lot of nurses that supported my family growing up, and we've got we know all of their names, we know all of the doctors, we remember them. I go to hospitals now and I'd be like, oh, this was my first doctor, and this was the nurses, and this was, and everybody knows everybody.
Yeah,
so
it is. Yeah.
Beautiful. Well, thank you so much for coming on and for sharing with us. It's been so beautiful to have you here.
Thank you very much for considering us. I feel very proud to represent the Royal Children's Hospital.
I'm very thankful to be able to pick your brains and to have time with you, and thank you for the work that you do. This podcast deals with some heavy things. If this brings up anything for you or somebody that you love, it's important to reach out for help. The Heart Kids Helpline provides support, advice and guidance for people impacted by childhood heart disease. You can call the helpline on 1800 432 785. To access more information about childhood heart disease as well as support from Heart Kids, visit the website heartkids.org.au. The information on this podcast is not a substitute for medical advice from your doctor or healthcare team. Always talk to your doctor about matters that affect your health or your family's health.